So now that we have looked at what is tennis elbow, as well as how to diagnose tennis elbow clinically, we'll move on now to talk about some of the treatment modalities that we use for tennis elbow during a physiotherapy session. The first thing that we usually do is to provide some good advice to the patient in terms of load management. So obviously, say for example, in a painter, if painting hurts your elbow, then you might want to stop doing painting for a period of time. Or let's say if you're doing a painting job, you want to be making sure that you're taking short breaks every now and then, because tennis elbow is predominantly an overloading problem of the wrist extensors. So until you find a way to offload the wrist extensors, it is very likely that it will continue to hurt. The other modality that we usually look at is manual therapy, and this is a bit of a hit and miss. So most clinicians usually try one or both of these techniques that I've described here. So lateral glide of the humeral ulnar joint, or posterior anterior glide of the radial humeral joint. So these two techniques, right, what they aim to do is to reduce the amount of pain in the elbow, so it gives you an opportunity to do some of the exercises that will help to strengthen the wrist extensor muscles. And some of the exercises that are commonly prescribed would be your eccentric wrist extensor exercises, your isometric wrist extensor exercises for extremely painful elbows. We give wrist extensor stretches as well as icing post exercise as part of a more complete physiotherapy management plan. So if you look at the management of tennis elbow as a whole, what's important is that we get patients to offload the wrist extensor tendons by stopping the stuff that hurts, as well as to provide a window of opportunity, so to speak, with manual therapy, as it provides a pain relieving effect. And finally, we do exercise therapy to strengthen the tendons and the muscles so it stops getting overloaded. I hope you found the information in today's video helpful. Do let me know if you have any questions about today's presentation, and see you next time.